Today we're going to take a look at the Sequoia C512 shared system sitting at software revision 12.221, very stable software release. This system has a CRT monitor, NTSC video, it does cardiology imaging, OB calcs, and vascular calcs. So it's a very versatile machine. It has customizable annotations as well as customizable imaging presets. It also has native tissue harmonic imaging. It has a built-in workstation which allows you to look at the images like we are at the moment. What we're looking at now are a few test studies that I did earlier. This is a vascular study using a 15L8. And as we go down through, you'll see a triplex mode image where we're going to have color, 2D, and pulse Doppler. And you can see the M mode function. And we come back to another carotid study. Okay, this is some images with the 6C2, which is an abdominal probe. And this is a dual mode with B mode as well as 2D. There's a triplex mode, color flow, pulse Doppler. Here you see a clip of color flow in the liver. You can see the nice edges of the diaphragm, the kidney, and the parenchyma of the liver. And we'll come back, and this is a standard 2D image showing the kidney and the diaphragm and the liver again. As we work through the system, we'll come out of the study utility and we'll discuss some of the other options that are in here. This has DICOM store and DICOM print, which allows you to interface with a PACS system or a teleradiologist who can read your images from anywhere they have a PACS system. And there's a program that we have that we can discuss with you where you can refer high-risk studies to a teleradiologist if you'd like to retain your patients and generate some extra revenue for your practice. And call me on that if you have an interest. This is Jeff Majors from Pinnacle Medical Imaging. Phone number is 619-674-6563, and my website is www.pmijm.com, as in Pinnacle Medical Imaging, jeffmajors.com. Check that out. You'll see the kind of stuff that we do. This system comes with a Sony black and white printer. You can also hook up a color printer, VCR. It uses the 3.5-inch MO disc to store patient studies, and it also backs up everything within the system as far as system presets and feature keys. Look at patient modality work list. You can pull in studies from your server if you want to do that. It has tissue equalization. It also has an EKG module with waveform and physio management if you ever wanted to get into cardiology. And for cardiology, you would use a 3V2C transducer. And you can go through a broad range of transducers. This one is a 6C2 for abdominal imaging. You can go all the way up to 15L8, which I showed you earlier for vascular studies. And quite a few image adjustment features on here. Slidable DGC pots. You can control the depth, the focal zones, the dynamic range. These kidney keys are nice. They're multi-purpose functional keys. You can do a clip store and do a quick cine loop by freezing and rotating back and forth. You also have quite a few features up here: persistence, post, B color, space-time, edge, delta, and then you have this. This is the tissue equalization, which is kind of like an auto gain function. All in all, a great system. And again, you can find these on my website, or you can contact me directly. Jeff Majors, Pinnacle Medical Imaging, www.pmijm.com. or 619-674-6563. Thank you.